the health service itself. Tonight, is the NHS fit for the future? Well, welcome to Guy's Hospital on the eve of the 70th anniversary of the NHS. What began as a bold social experiment to provide free healthcare to everyone who needs it has grown into one of the world's biggest employers and one of the UK's most treasured institutions. Nearly 8 out of 10 people say it is crucial to British society. But most also agree that the NHS is struggling. An ageing population, medical advances, changing demographics are putting the finances of the health service under some strain. And they've left two competing visions for the future of the NHS. More public money or indeed more private investment. Well, over the next hour, we'll hear from leading advocates on both sides. And at the end, our studio audience will vote on which model they prefer. Which one will they choose? Well, here's our advocate. Sonia Sodha is chief leader writer with The Observer and a former advisor to Ed Miliband. She says taxpayers should foot the bill as the founders of the National Health Service intended. And Sean Worth was David Cameron's special advisor on health and says only more private sector involvement can keep the NHS afloat in anything like its current form. Now, assessing their arguments will be four people who between them know just about all there is to know about the NHS. Quite seriously, we have Sir David Nicholson. He was chief executive of the NHS for 8 years, from 2006 to 14. As chair of the Royal College of GPs, Professor Helen Stokes-Lampard represents 52,000 family doctors across the UK. Lord Darzi is a former Labour health minister and one of the world's leading surgeons. And Dr. Sarah Wollaston is a Conservative MP and chair of the Commons Health and Social Care Select Committee. What a panel. And welcome to you all. So let's get started. First, we're going to ask our two advocates to set out their positions with an opening statement about the NHS. Let's start with Sonia Sodha. Sonia.
Thank you. The NHS isn't perfect. Sometimes it delivers outstanding care. Sometimes it gets things very wrong. But public opinion shows us that us Brits are very proud of our NHS, and I think with good reason. Researchers have ranked it as one of the most efficient and socially equitable health systems in the world. And as a nation, we spend considerably less on healthcare than many of our international competitors. But there are two big existential tests facing the NHS. First is the changing nature of disease and sickness. Back in the 1950s, much of the NHS's work was about fixing one-off illnesses, one-off infections. Today, most of its energy is focused on long-term chronic conditions that people live with for a very long time, like diabetes, dementia, and mental illness. The second big test is our ageing society. It costs 5 times as much to treat an 80-year-old as it does a 30-year-old. Both of these tests create growing demand and growing pressures on the NHS, as I'm sure you're all aware. But they're not unique to us here in the UK. To put it crudely, they face all ageing societies that eat and drink too much. And they're an important reason why every industrialised nation tends to spend more on its healthcare as it gets richer, regardless of how its health system is organised or how much of it is delivered privately. So I think these cost pressures, they're an argument for allocating the NHS more resources from taxes as we get richer, not for shaking up our massively popular, taxpayer-funded, publicly provided NHS. And don't let Sean convince you otherwise.
Nicely introduced, Sonia. Now to Sean, who is going to try to do just the same. He sees more private investment in the NHS. Sean.
Thank you very much. Yes, just to say, first of all, when I first worked in an NHS hospital, it was over 20 years ago now, the system was under pressure then. I mean, if we'd known then the kind of pressure that we're under today, it would have been absolutely terrifying. So I agree absolutely with Sonia. I think that the system is under huge pressure, but I want to keep it free for everybody. I don't want it to change. It should be a taxpayer-funded system, absolutely, and it should be equitable. And that's something that I'm as proud of in terms of the NHS that Sonia is. But I want to add something, because I just don't think pouring in more and more and more money is the answer, right? Already we're going to have to get the equivalent of about 9% on all of our income tax just to keep the Prime Minister's current promise to add more taxpayer money into the NHS to basically dig it out of the hole it's currently in. It's under huge pressure. There's 2,000 odd operations cancelled every week because of staff shortages, funding pressures. We've got a problem. Money isn't the only answer, is my point. We need change, and we need more involvement from the private sector and charities and social enterprises to come in and help deliver the services. And that's not to sell it to them or to make people pay for it or anything like that. It's just to bring in new ideas, new ways of working, new technologies. I don't want to see an NHS that has to be constantly bailed out by the taxpayer at huge expense, whilst we're refusing to expand the services that people want to more providers who could do the job just as well or more efficiently. And if they can't do, then let's not hire them. But if they can, let's let them in and give them a go, right? So that's a very simple proposition. Why is that a problem? The problem is that people look at the NHS and think that any private sector involvement, at the moment there's about 7% of services like MRI scans or hearing aid clinics that are provided by the private sector. They're doing a fantastic job. When you're trying to expand that, there's a very politically and ideologically motivated campaign that says, we don't want that in here, it's privatisation. My contention is, and I'll finish with this, it's a completely infantile debate we're having that is being captured by politicians and some parts of the NHS establishment. And unfortunately, it will hold the NHS back, delivering the change and the opportunities that people need.
Sean, thank you very much indeed, and we're going to drill down on in more depth into some of those issues. But I want to throw this out to our panel, and first of all, start with you, Lord Darzi. In terms of, from both of our advocates, in terms of the diagnosis, to use the medical term, of what is wrong with the NHS, are they more or less on the button?
They both are. I think both eloquently talked about the raising demand, and I think you've mentioned the aging population. I just want to make one comment. That's not a burden. That should be a celebration. You know, in the last century, we have doubled the life expectancy of mankind. Now, you give me any professional or sector that managed to do that. Bankers, they've never managed to do that.
That's for sure.
Politicians, they've never managed to do that. That goes down to science, discovery, and a robust NHS. So we should be proud of that. A century that added years to our life. The challenge we're facing now, how do we add life to the years? How do we improve the quality of life?
Okay, I'm going to cut you off there because that's a great opening statement. Thank you very much indeed. And I'll throw that to Sarah Wollaston. So we shouldn't really be concerned about the fact that people aren't dying younger anymore. It is, of course, a good thing.
That was the whole point of it, after all.
Exactly.
And what I would say is, of course, it's public health that has delivered that. And that's the prevention arm of health services. And it's public health that often ends up at the bottom of the queue with funding decisions. And we need to look at the whole system, the NHS, social care, and public health altogether, and take a long-term view as well as address the here and now.
That was Sean Worth's point there, though, really, that and I have to ask you, because you're the MP, you're the politician on the panel. It's a nettle that politicians seem loath to grasp when it comes to root and branch reorganisation, perhaps. Maybe that has been tried. We're getting on to that.
Of course, what the health service doesn't need is a massive organisational churn. What it needs is some stability. But as I say, what we do need to get better at is planning for the long term, not just for the funding, but also for our workforce, and thinking about where we can invest the money most effectively to get the best for patients, and come back to patients and what they need.
Okay, Helen Stokes-Lampard, I mean, with that celebration of longer life expectancy, nevertheless, then the creaks, the strains are really beginning to show now.
Well, they are, because for all the reasons articulated. And actually health and how health is determined is much wider than healthcare and social care and the public health. It's education, it's the economics of a society, and it's all those things together. So we can focus tonight on the NHS, and that's right and proper on the eve of its 70th birthday. But actually we do need to look at health in the wider sense when we look about people's well-being. And Sonia mentioned about our unhealthy living, about, you know, so many of the diseases of our modern society are related to the lifestyles we lead. And so, you know, and society has a part to play here. This isn't just about the NHS getting its house in order. This is a wider thing too, and we need to think about that as well.
David Nicholson.
Right from the beginning, I would say that I think the private sector can help us in lots of ways in the NHS, and does help us in lots of ways in the NHS. But
is it over-politicised, that argument?
Well, the issue for me very often is that it's about the values who drive these organisations, about the right values. But can I just raise the issue about, I think Sean mentioned taxpayers bailing out the NHS in some way. The thing about we have to understand is that health expenditure is a really good thing. Economically, it's a really powerful thing. It's one of the best ways that you can improve economic growth in your society. Public expenditure on healthcare, generally speaking, gets spent in this country with people who work in this country. So it's a really powerful way of driving the economy. So we shouldn't pretend, we shouldn't get ourselves into a place that somehow health expenditure is something we need to avoid or is difficult. We need to make sure that.
But there has to be a limit to it. I mean, there is a limit to how much the nation can afford.
Of course there is. And I have to say, I've worked in a large number of countries over the last 4 or 5 years, and there isn't a country in the world who's sat there at the moment thinking, we've got it all sorted, we've got enough money in our healthcare system, we're doing everything that we need to do. So this kind of tension and pressure is a necessary part of delivering a healthcare system. And the other thing I'd say is that there's a slight issue here about public sector bad, private sector good. And all I would say is that in terms of labour productivity, labour productivity in the health service over the last 7 or 8 years has been remarkable. It's grown at a very high rate. In fact, if labour productivity in the rest of the economy had grown at the rate that it has in the health service, we'd have paid off the whole deficit of the country and be sat on a pile of money. So, there are things that
NHS leads the way. Industry should follow.
Other people can learn.
I just want to ask Sonia, that point that David was making, I mean, do you think that, private sector bad, public sector good?
No, I don't. I think that's way too simplistic. I don't think that I wouldn't like to see 50% of NHS services delivered by the private sector. I think that would change the feel of the NHS. But I think where there's a very strong case that the private sector can add things, great. The one word of caution would be is that the state has got a history of writing some pretty bad contracts with the private sector. Just look at PFI deals with hospitals, for example, that led to the building of new hospitals. So it's definitely not the case private sector good, public sector bad either. I think we have to take a very pragmatic view about things as they come up. And
Sean, this issue of the spending being a burden that David's pointing out, that's not a burden. There are huge benefits from it for society as a whole.
It's not. Of course it is. It's fantastic. But I think there is a reasonable argument to say that if you look at the trajectory of how much spending has to go up to meet the demand of the NHS, right, it is going to get bigger and bigger. You and I are going to be paying more in income tax to fund the kind of NHS that we want. And I think most of us probably accept that. But we've got to have more than that. We've got to have new ideas, new technology. We've got to embrace change. We've got to embrace innovation. And nothing should be taken away from the NHS. I'm arguing that more should be put into it, but it doesn't have to all be money.
OK, well, we're just laying out the groundwork at the moment. We'll get much more into funding in a moment or two, but I want to ask you, Lord Darzi, and this is the C word, and it is crisis. Now, as long as I've been in journalism, which is more years than I want to remember, we've been talking about a crisis in the NHS. Is there one from your point of view?
It's challenging. It's crisis. It depends how dramatic you want to be.
Yeah. Well, is it us journalists that are describing it as a crisis? But I mean, it seems the general public are beginning to feel that now too.
Huge pressure within the system. I work in a hospital like this, across the river, at St Mary's Hospital, and we can feel that on a daily basis. We have staff shortages. We have a huge growing demand in the A&E. We have issues in admitting patients for elective surgery. So there are challenges, but the system is coping. The one thing, may I just say, I've just done a recent review with IPPR, and I looked at the quality and the outcomes of care. Now, than 10 years ago when I was in office and I led a major review. And I could confidently tell you that the quality and the outcome of care today is significantly better than when I was a minister. That's a fantastic news. So despite all the crises, whatever you hear in the papers, cancer outcomes are better. There's a 5% improvement in survival in 1 year. There's tremendous improvements in cardiovascular disease. I'm not saying we're done. There's a long way to go, but it is much better. What is challenging is what we call access, getting into the system.
Yeah.
Whether it's primary care or hospital. Once you get into the system, you'll be rest assured you're going to get a good quality care.
Well, a lot of thoughts on that I can hear from the panel beside me, but we'll get on to those in a moment or two, because, Sir Lord Darzi, you touched on the issue there of outcomes, which leads us nicely into our next session when we will hear from our advocates. But I want to remind you all first off, though, that at the end of tonight's debate, our studio audience here at Guy's Hospital will be voting on what they've heard. They are listening intently and choosing whether more public money, this key question, whether more public money or more private investment is the best way to secure the future of the NHS, as that argument develops throughout the course of the evening. But now I want to focus a bit more on that issue that Lord Darzi mentioned there, that surely resonates most with everyone involved in the NHS, patients and staff alike. That is the care that it provides and the outcomes. First up this time is Sean Worth. Sean.
Thank you very much. So we'll talk about NHS being in crisis. Social care is a massive problem, and I promise you, having worked in politics, in opposition and in government, no politician will want to be straight with you about this problem or want to talk about it with you. That's the unfortunate truth. Again, we've got a huge problem. The social care system is not funded publicly. It's a mix of private investment and everything else. The only thing I would say to this is that it is literally inconceivable that we tack on an ageing population with huge social care needs to the taxpayer bill of younger generations. It's not going to work. No serious economist has even looked at this and said that that's going to work. You shouldn't have to pay for it. The big thing that needs to happen is that the generation most in need of care is actually the wealthiest that has ever lived in this country. They're sitting on £1.5 trillion of housing equity. It's a controversial proposition sometimes, but I believe that people should take the responsibility to release some of that wealth that they have to pay for their social care needs in order to protect younger generations from having to pick up the bill, so that they can have the opportunities that they have. But so that it's fair, just to finish, so that it's fair and some people don't face catastrophic costs and others, by good fortune don't have any, there should be an insurance pooling system, which unfortunately the market cannot provide, because it can't cater with the extreme risks at some ends of the population. The government should step in and help to create that, but people unfortunately will have to take more responsibility for social care in later life, rather than putting that burden onto their children.
Okay, insurance funding for social care with an initial investment from the government. Sonia, what do you think?
I completely disagree with Sean. So I think there's a really important principle enshrined in the NHS. And it's not just that the affluent pay more than the poor through their taxes for care. It's also that the sick don't pay more than the well. And if you look at cancer care, if you get sick, your costs are covered. At the moment, if you're unlucky enough to get dementia, your costs aren't covered unless you don't have very many assets. And I think that's incredibly inequitable. Why should we apply that principle of if you're sick, you don't pay more than the unhealthy, than the well rather, in the NHS, but not in social care? And I think that distinction creates all sorts of problems in the system. We don't even save enough for our retirements, for the healthy period of living when older, let alone the miserable prospect of spending a few years in a care home in the run-up to our death. People are always going to underspend on social care. That's always going to heap pressure on the NHS. So I think we need to fund social care on the same basis as the NHS. It's time for a 1948-style settlement not for the NHS, but we need to extend it to social care. Now, you might say, gosh, how do we pay for it? Well, we're a rich society. We can afford it. Of course, we should ask the baby boomer generation to contribute more, but that should come through progressive taxation so that those who are unlucky enough to get dementia don't end up paying more than those who are lucky enough to live well till the end of their lives. And the final note that I'll end on is I completely agree with Lord Darzi that extending lifespans are an amazing scientific achievement that should be celebrated. But the fact is, at the moment, they do come with a price tag. Until we discover that elixir that allows us to live in perfect health until we reach our deathbed, there are costs that come with it. We have to be prepared to meet them as a society. Otherwise, quite frankly, the consequences are unpalatable for our mums, our dads, our elderly relatives. So this is a cost we can afford to bear. Economists have actually looked at it. A very prominent economist did a review for the King's Fund back in 2010 and concluded that it was possible, as long as our politicians are brave and say, we did this for the NHS in 1948, we're going to do it for older people here and now in 2018, and I think they can do it.
OK, well, I'm going to come to Sarah Wollaston on that in a moment or two, but Helen, you are nodding along there, and give me it from the perspective of GPs, this dilemma. They're really rather caught in the crossfire in all this, aren't they? More and more, in particular, elderly people coming along, seeing their GP, and GPs not knowing what to do with them, where to send them. But the hospitals are full and the social care system a mess. Well, what do they do?
I use a really simple metaphor that people's lives are their physical situation, their social situation, and their psychological situation. So when they walk through my door, I'm interested in their medical problems, but also where they live, how they live, and the care they have matters too, and also the psychological elements. But you can look at another three elements, which are the primary care sector, so general practice and the first point of contact care, the secondary care sector, the Lord Darzi represents, and the hospitals David has, and also the social care element. And if one of those is out of balance, the pressure on the others is completely untenable. So we have to get our social care embraced into this. I absolutely agree with Sonia. I mean, it's a really bold proposition. I like it a lot, and I'd love to know how we could work it. But actually, we do have to have them in equipoise because it puts the rest of the system under strain. General practice, huge strain at the moment, unprecedented.
Well, is it a mess? I mean, have you seen areas, do you know of places where it actually works in the manner you describe, where it is joined up?
Well, yes, there are some really bold adventures happening out there. So you've got places like Manchester who are taking a bigger picture view of health and social care and well-being and getting education involved and local government involved. And I mean, it's a big experiment at the moment, but we're watching closely because it could have lessons for all of us. From my point of view, the bit I know best is general practice, and we're desperately short of GPs. We're probably about a GP short for every practice in the country. I mean, that's the harsh reality of it. So when the patients come through the door, not only are they struggling to get the appointment, and when they come and see us, when we try and do our stuff and our best for them, we've got nowhere to send them. We're compensating for the social care sector. We're compensating for the fact that they've had their operations turned down, that they can't get an appointment. It's a year to see a specialist. And we're firefighting. Okay. And that's not right. We can do better.
Well, I'm keen to get to Sarah on some of those funding models in a moment or two. But David Nicholson, the thought occurs, and I want to hear from you on this, on the best practice. And I know the NHS for many, many years has been observing and encouraging best practice and carrying out experiments and tests. It doesn't seem to spread, though. It doesn't seem to get joined up. If you find somewhere where it does work, it doesn't move on.
This is not unusual in healthcare. Change in healthcare is really tough to do anywhere in the world. People will tell you that. Partly it's because we've got a very educated and discerning workforce who don't want to just be told what to do. They want to discover themselves, work out how to do it and make the connections themselves to make it happen. And sometimes that takes time. And in a strange kind of way, by trying to rush some of this stuff, we've actually slowed it down. There are all sorts of ways in which we can make it happen. In different countries have tried different methods, but at least we have a healthcare system which enables it to happen. Most other countries don't even have a system that can work like that.
OK, we're going to get on to reorganisation in a moment or two in our next section. You touched on that. It's all going to cross over, of course it is, and particularly at the centre of it all, this issue of funding. And there we had it encapsulated. Sarah Wollaston there. Well, you know, Sonia Sodha saying for all the problems, we can afford it. We're a rich nation. Sean is saying, well, you know, let's bring in some money from those that can pay. And this, of course, was elements of that were in the Conservative manifesto in the last election, and look how that went.
We can pay, but we do need to level with people about how that's going to be funded. I'd be delighted if there's a Brexit dividend. I don't happen to think that's going to happen. We can't depend on it. What we need to do is level with people about how we can bring it in. And of course, there are things the government can do about adjusting, for example, whether they cancel plan changes to things like corporation tax and tax thresholds. We can grow the economy, but we also need to actually say to people, are you going to be prepared to pay more? And we need to do that fairly across the generations. We can do it. We know that they provide personal care in Scotland, for example, and it produces savings to the whole system. Because if social care fails, people end up in much more expensive settings in hospital. So it's the right thing to do, and it also protects people from catastrophic care costs. And my committee worked with a citizens' jury alongside another cross-party select committee. And the citizens' jury, a number of people, just like yourselves in the audience, felt that they wanted to see extra taxation earmarked for the purpose that it was intended for. And they suggested, and we agreed with them, that actually having an extra premium to national insurance, for example, but spread fairly across the generations. They also supported having an earmarked element to inheritance tax, so we do actually bring in part of that asset wealth.
Would you like to see that in the Conservative manifesto? I mean, it's Lib Dem policy, isn't it? Penny for the NHS.
Well, that trouble is we've had a political failure. One party brings up something and another party says it's a death tax, then the next time round we get told it's a dementia tax. We've got to get to grips with this. That's what I think. And I believe that the public want to see political parties working together and
that's a very good
getting
point.
This sorted. And we've suggested that across party.
Well, let's bring it across the parties, because with your Labour politician hat on, that does happen, doesn't it? I've witnessed it, where one party in power comes up with some kind of solution for social care. The other lot call it a death tax. They get into power, bring it in, and the opposition call it a death tax.
Well, let me just start. I fully support Sarah. Absolutely delighted what she said. Let me give you my own example. 25 years ago, when I started as a consultant, where I am now, I could see a patient who's an 85-year-old, and I used this recently as an example, who had a cancer. I wouldn't have operated on this patient 25 years ago. With the technological advance I could do a keyhole operation, wonderful lady, delightful, wonderful recovery, ready to go home in 48 hours. She's still in hospital a week later because there is no social care. Do you know how much that costs the NHS? £3 billion a year. £3 billion of your money. That is equivalent 2.3 million bed days a year. No surprise we can't get patients in. So there is a negative impact here. And the manifesto of the Conservative Party, I thought was a good idea, terribly communicated, awful. But actually,
no change.
Go back and see the policy of it. There was something in there. And I think I put all my confidence in the Select Committee coming up with something, embracing, stop playing party politics with health and social care.
Cross-party agreement. I've got agreement here. Just before we move on, I've got to ask our two advocates, though, to have some interchange on this very issue. I mean, Sean, could you not live with, you both agree that more money has to go in, if the public did support it, could you not live with it coming from general taxation? We are a rich nation, as Sonia says.
If the public could support it is one thing, but I mean, my argument is about younger generations, actually, because if you take Sonia's argument, you're looking at a problem and you're just pointing at people and saying, you've got to cough up more money. And these are people that don't get free university education, they can't get on the housing ladder, they don't have final salary pensions, they don't have the kind of wealth that an older generation that we've got has amassed now. And I'm just saying, in a progressive society, should we not burden younger generations? Should we ask those that need that just to do something more if they've got the wealth to do it?
Okay, Sonia, why can you live with that? But a progressive policy, and it is true that one generation seems to have a lot of the wealth, particularly stuffed away in their houses.
The answer is very simple, to Sean's point. You do it through progressive taxation. So you do it through wealth taxation, like inheritance tax. You might look, for example, at taxing people in retirement who have big final salary pension schemes. They've paid off their mortgage, they don't need that money. So you do it through targeted taxes. But the big difference between me and Sean is I'm saying whether you've got dementia or not, If you're older and you're affluent, you pay into the system. I think we mustn't forget as well, there's this whole stereotype and myth that all the baby boomers are hugely wealthy and sit on £1 million houses. That's absolutely not the case. It might be true in some bits of London. It certainly isn't true in other bits of the country, like Wakefield or
Quick thought from David. You had your hand up, and then we must move on.
Only that there's a real dangerous argument here about pitting generations against each other, when actually it's about them working together. So in Germany, they talk about the young for the old, the poor, the rich for the poor. You know, as social solidarity, that's what it's about, and that's most important.
Very interesting point. Listen, we must move on because there is so much to consider. And what we want to consider now is how the NHS is organised, how the money is allocated, how it's spent. Well, the Health and Social Care Act back in 2012 was intended to reduce bureaucracy, but actually made the system more complex, many think. So is the way money is managed fit for purpose? Sonia Sodha starts this time. Please give us your views, Sonia.
Well, I don't know about you, but every time I hear the term reorganisation, it just makes me want to switch off. The NHS has been subject to a number of really big reorganisations over the last 20 or 30 years. And I think invariably these are the pet projects of politicians who come in, want to leave their mark, saying, hey, we're going to mix things up here and do things differently. And often there's very, very little evidence that a big structural reorganisation is going to do the thing we all really care about, which is improving the quality of care. So we've had, purchaser-provider splits, scrapping PCTs and replacing them with CCGs, acronyms that really just make your head hurt. And I think we need our politicians to be much longer term about the NHS. There's no evidence that doing a wholesale reorganisation improves care. There is one big structural issue that needs fixing, and that's the one that I've already talked about, which is the split between the NHS and social care. But that seems to be the one big structural problem that politicians just don't want to fix. So I think we need to focus much, much more on quality of care, our inspections regime. How do we make sure that staff that see something going wrong feel able to speak out without fear of losing their jobs? That's the sort of stuff that improves the quality of care, not Andrew Lansley sitting down with a flip chart and redrawing the structure of the NHS.
OK, Sean.
Well, nobody would have designed the NHS as we currently have it if you had a fresh start. We have a very separate system of social care, as Sonia said. We have hospitals, which is a completely different system from your GP, where you often go first with your first complaint. These services aren't really that well joined up, and there are efforts now to try and integrate them more. You'll hear the word integration a lot when you hear about healthcare. And I agree that structural reorganisation is, it just switches people off and it costs a huge amount of money. So I'd just go back to my original argument. The issue with the NHS is not that it needs to be shaken up and reorganised and everything else, or the model changed. Everyone accepts and likes the way we get free care if we need it, and it's very equitable. The issue is, can the NHS keep up with the demands that we're continually place on it, and can it embrace change, new technology? So I'm saying that it needs to bring in more expertise from outside itself, not selling bits off, not charging people, but allowing the services to be delivered by many, many more different types of providers, some in the private sector, some in social enterprise, charities. It's already happening in small patches, but we have a ridiculous, controversial privatisation debate, which is completely manufactured and false, which prevents this from happening. And finally, the worst part of this is if you actually do a poll with ordinary, regular patients and say, would it be reasonable, would it be beneficial to try other providers to deliver your services and give you a choice of that? The vast majority of them say yes. And most interestingly, it's the poorest who most want that change because they face the least choice under the present system.
OK, thank you both very much indeed. David Nicholson, on the issue of reorganisations, you went through a fair few yourself. Do they end up just rearranging the deck chairs?
Well, the first thing to say is the international evidence is very clear on this. It doesn't make any difference at all what kind of organisation you have for your healthcare system in managerial terms. What matters is how many doctors, nurses, allied health professionals, how much money you spend on it. That's what makes the difference to outcomes. And very often, in my experience, it's been, I think it was described by Mary Goldring as messing about masquerading as action. so that when we lose when everything else is too difficult, we reorganise, and it's really dangerous for the system. Just aside, I was looking at the Gosport report, which is everybody in healthcare should look at that, and a whole lot of things have been said about it. But one of the things when you look at it, the number of different people who were engaged and involved in the management of that hospital and the supervision of that hospital must have changed almost annually from 2000, right the way through that period.
But it's back also to the point you were making about empowerment of the people who work there all the time, and this issue of whistleblowers, of people speaking out about bad practices and people speaking about best practice as well.
So where you start from is you get people to work together, and they start to tell you what kind of barriers and obstacles there are to working in the best interests of patients. And then you build your organisation around that. You don't do the other way around, which is to stand with Andrew Lansley's flip chart. It was a very large flip chart, I have to say, and then draw it all out. That simply won't get you to the right place.
Okay, well, Sarah Wollaston, I mean, Andrew Lansley, Lord Lansley now, he's the man behind it all. What were you thinking at the time as you were hearing the plans coming down the track?
The Select Committee very clearly said that we thought it was overly complex, and the point is that we focus too much on systems. And as David Nicholson says, the big question should be, does it make the experience better for patients or not? And the answer is, it very rarely.
Do you think that
does.
question wasn't front and centre? It was all about.
It wasn't.
I mean,
the trouble is that many of us said at the time that this was overly complex, introducing far too much fragmentation, and it would have been better to have focused on patients. And that, unfortunately, did not happen. Because if you look over the years, I used to teach junior doctors and medical students, and I gave up teaching them about the structure of the NHS simply because I knew because it would have changed by the time they qualified, and that is the try. And the other thing that we found on the Select Committee is we have this acronym spaghetti, STPs, CCGs, all these different things, ACOs. Nobody knows what they mean, and the question we have to ask is, does it make the experience better for patients? And very often that means focusing at local level, getting people to work better at local level, rather than just having this endless debate about changing around systems. Let's focus on the patients.
Okay, I'm going to come to you for Helen very, very shortly indeed. But Lord Darzi, with senior technicians, if I can call them like that, like you, practitioners within the NHS, do you get frustrated by what you see from the managerial class?
Absolutely. When I go to the ward, first thing I ask, who's in charge? When I treat a patient, the patient and the family says, who is in charge of my care? I say, I am. There's an accountability issue as well. It's just the structure. And it's not just me, it's the nurses that help me, it's the physiotherapist who's looking after the patient, it's my communication with the general practitioner who's going to take over the patient when it comes to the community. Everyone knows who's in charge. If you look at the landscape nationally, there is NHSE, NHSI, CQC, PHE, HE. It sounds like a big, newly discovered drug. You go out there and say, who's in charge? I mean, 10 years ago, at least, I used to turn around when I was in office, who's in charge? Nicholson was in charge.
Yeah.
And decision needs to be made. He was the accountable officer. Now we have we need to rebring this, align this, and I'm delighted to hear from the Health Select Committees. In actual fact, to be fair, the Prime Minister said recently, if the NHS feels the management, the doctors, the nurses, the GPs working in it, that there would be a simplified way of managing the NHS, then it should go to the Select Committee. And I'm looking forward to some form of common sense in bringing not just structure, but accountability.
Well, just before you come back, Sarah, I just want to hear from Helen, because GP is obviously hugely important after those reforms, put right into the middle of it all. Did they get too much of a burden, in a way, out of all this?
Do we can spend all our time looking backwards, Dermot, but where we are now, we need to be looking forwards with healthcare. As everyone has said, we wouldn't choose to be where we are. We are where we are. We need to learn from the past, but let's look forward about what we can do to improve the current situation. I mean, obviously, I'm going to argue for shoring up and supporting general practice. We are at a parlous state at the moment. We've had these promises, but we're still desperately short of people, and that's not just about GPs. It's about district nurses, health visitors, physios. It's the whole healthcare team in the community, because we know the most effective and and efficient way of running a healthcare system is to invest in your primary care infrastructure. Because when we're functioning well, we protect people, we save them. They don't need to go to hospital as often if we can do more for them in the community. Everybody wins if the general practice is in a sensible state.
Sarah, you wanted to make a quick last point?
Yes, one of the things that we recommended on the Health Committee was that if we're going to make it simpler and there need to be tweaks to the legislation, please let's have that designed by the Health Service and social care and patient groups, and then we will examine their recommendations.
But as David has said there, perhaps there's no point now. Leave it as it is. Is that what you are saying? Leave it as it is. It's been done. There's no point. It might not work, but leave it as it is and just let's concentrate on the funding and the resources.
Well, there is no doubt. I don't know whether we're going to talk about the 3.4% at some stage, but
that's what we're getting on to.
The key bit of all of that is how do you turn that into people on the ground as quickly as you can, and you've got a system which is not designed to do that. So there is some urgent work needs to be done, and I would say it should be driven by the front line, but should concentrate on simplification. That should be and at the end of the day, if we can't explain it to the patient and the public how it works, how on earth can we explain it?
And thank you for mentioning the 3.4%, the 20 billion. We're getting closer and closer to the point of voting on that. One last topic, though, before we get there, before the audience get to have their say when they vote on whether more taxation or more privatisation is the best route forward for the NHS. And I want to look now at the pressures, the future, and perhaps the solutions that are coming down the track as we look to the next 70 years of the NHS. Sean Worth, first this time.
Yes, I mean, looking at the debate tonight, I think you can be a pessimist or an optimist. The pessimists will look at the huge pressures on the system and think, oh, goodness, we just have to put our hands in our pockets and continually pay more and more and more until essentially we're taxed out of pocket. There's a positive vision which says, yes, we'll have to put more money in, but we'll have to change as well. And the NHS has to be faster at adapting to new technology, new providers, new ways of working, all the things that we want to see the NHS do, that patients we know want to see the NHS embrace, but doesn't happen at the moment because, basically because of politicians and the NHS establishment being resistant to that change. The key, what I'd really love to see, and there's links to the extra funding going into the NHS. I would love to see that funding not being poured into doing the same old thing, at the same time. There's money going in, and I know it has to fill some gaps, but let's keep some money aside and create new funds for really innovative new practices that we can, from around the world, including new medicines, which are terribly slow to get to the market, from market, to the patient. Again, because we've got this incredibly complicated system. Let's get that money into more innovative services, bring new providers in, and new medicines, get that to the front line. That's what I'd really like to see the future of the NHS.
Okay, Sean, thank you very much indeed. Sonia?
Well, Sean talked about pessimists and optimists, and I think it's pretty clear who he was referring to as the pessimist. I would characterise the debate slightly differently, though. I think it's a debate between realists and fantasists. And I think the real position is confronting the extra costs that face the NHS and being optimistic about our capacity as a wealthy society to pay for it. I think there is a lot to be excited about in terms of the medical technologies that are coming down the line that are going to make our health better. Things like genomics, artificial intelligence, big data. And I think Sean's been a bit unfair on the NHS, actually. The NHS has been at the pioneering edge of some of these technologies, like immunisation over the years. We just learned yesterday, in fact, that the NHS is going to be pioneering the use of genomic technology. So doctors are going to be able to look at cancer tumours and try and predict, using the DNA in them, I think, I'm not an expert, to see what treatment they might respond to best. So there's definitely stuff to be excited about. Two words of caution, though. First is that this medical technology is expensive generally. It's not really a way of saving money. It's stuff we need to spend on to improve care, to make sure we do all get to our deathbed living really well. And the second is, I think sometimes it's easy to get obsessed with technology while forgetting some of the simple and the basic stuff. And I talked about the fact that a big challenge to the NHS is that people have got many more conditions that are chronic, that are associated with lifestyle, obesity, drinking too much, smoking, not doing enough exercise. Now, there are services that work in helping us live more healthily, things like stop smoking services. But a big challenge is that it's become much easier for the government to cut stop smoking services, say, than it is to touch the NHS, because we're very protective of our hospitals. And that means we've seen some of the services like stop smoking being cut, and that's going to load even more costs on the NHS in the future.
Sonia, I'm going to cut you off there because guess what? We're running out of time, but I'm going to throw this back at you. Start with Sean, first of all, because Sean, you were accused there of perhaps being a pessimist. You're not excited enough about the future of the NHS.
I'm very excited about the NHS, and I'm certainly not criticising it. You're right, it's actually of the public sector, it's the biggest user of new technology there is in the public sector, and so it should be, because it's the biggest public service we've got. But, and I'm not saying, there's no criticism, and it does a fantastic job. What I'm saying is that we need to add to it. We can't just keep it the same and ask the taxpayer.
All right.
To pay the same old thing.
Sean, thanks very much. Of course, I can throw that back at Sonia. That's all he's saying is, bring in some expertise from outside if it's going to benefit the NHS.
But the reason I implied that he was a fantasist is that it's wrong to think that you can do that without more resource. Resources aren't the only answer. There's no way that just by putting more money into the NHS it's going to be the best service in the world. There's other stuff we have to do. But it's an absolute fantasy to think we already spend a lot less than our international competitors, or some of our international competitors, on our health system. It's a fantasy to think that if we don't invest in it properly, it's going to continue to be a world-class service.
Okay, right, where did the time go? Our experts here chomping at the bit to get their say. Lord Darzi, optimist, pessimist about the future, 70 years more for the NHS and much more?
Always optimist. I've just told you, doubling life expectancy, that's because of science, innovation and technology. Absolutely. That's the evidence. Looking into the next 30 years or 70 years, the examples have been talked about. Machine learning, for example. We, back in the 1940s, we saved Europe and the Western world on the back of Alan Turing's work in breaking a code. Why can't we break the genome code and understand cancer and have targeted treatment? We can do that. We have the science in this country. We should be very proud of it. It's not an added cost. Every pound we spend on health, you get 2 pounds.
Well, you can sell that around the world.
£2 back, absolutely, absolutely. Do you know how much the life sciences industry brings? 67 billion pounds back to this economy here. So we need to be celebrating that. 70% of the British population have smartphones. Why aren't we using that in delivering healthcare and advice? And communication. It's all out there. We just need to embrace it.
Sorry, Lord Darzi, we are running out of time. David Nicholson, I want to come back to that point you made about the 3.4%, the extra money going in. We're talking about resources now and the future and the continuing demands. And you mentioned productivity, but isn't it the fact that we're hearing now from health chiefs there isn't much more to go for in productivity improvements now? It is all about the money.
But many of the things that Lord Darzi was describing improve productivity. And I think if you look around, most healthcare systems in developed countries are going through this argument, this debate at the moment. There are two things they're all saying. The first thing is that in the future, people will have to take more control over their own health and their own healthcare than they do now. And we need to help people to do that. And technology is a fantastically incredible thing to do that. All sorts of things we can do that. And the second thing is investing in primary care. Those two things everyone is thinking, and that is, I think, where the future
and particularly
lies.
Technology when it comes to GPs, Helen. And we're hearing that this year we're all going to be able to get an app and book appointments and no early morning phone calls and pretending it's an emergency. We'll believe that when we see it.
There are loads of exciting apps out there, and I mean this new all singing, all dancing NHS app, great, lovely, logical, sensible. As Lord Darzi said, 70% of people have got smartphones, lovely. But actually, what we mustn't do is widen the health inequalities in our society. I worry about the people who haven't got a smartphone, who can't access the internet, the people who more than ever need to be able to turn up at a surgery in their community with somebody who knows them and cares for them and understands their whole issues.
And because they can't do that, they're turning up at A&E departments.
Well, exactly, and that doesn't help anybody. We need people to get to the right place and get the right care. Apps, lovely. And if you want to know some great apps, look at the NHS digital website. There's loads of really fun apps on there, good healthcare apps.
Put the number out there in a moment or two.
Absolutely.
Well, Sarah, glass half full or empty?
Oh, I'm an optimist. But what I'd say is that the NHS's greatest asset is its workforce. So let's not forget developing, training and retaining our workforce across the whole of health and social care. And if we're going to do something in digital technology. I'd like to see, rather than the Secretary of State owning your medical records, I'd like to see you own your medical records, and for you to be able to share them wherever you go, so you're not having to keep repeating your story and having notes and records lost.
Well, they tried that, didn't they?
But it was done very badly, and we need to learn the lessons from how that failed decades ago and get it right this time. But we got it wrong last time because we wanted it all controlled still by the state, and we need to put the power back with you, the patient. You own your record and share it with who you like.
Well, what a nice point to end our contributions from the panel. That is the final contribution in the debate from them. But before the audience gets to vote, the all-important audience vote on who's made the most compelling case, we'll have a final word from each of our expert advocates, encouraging you to vote for them. And first with their closing statement is Sonia Sodha.
I've presented a simple case here tonight, I think. Living longer is something to be celebrated, but there are costs involved with it. And if we don't face up to it, we are going to end up running the NHS into the ground. The arbitrary rationing we've seen in the last year, the cancelled operations, that's going to get worse, and you're going to see more people opting out and getting private health insurance. That's going to create a two-tier system with one standard available for the affluent and one standard available for everyone else, and particularly those on low incomes. And I think that's going to undermine the very basis of our taxpayer-funded universal NHS that is really adored by the public. So I would urge you to vote for putting more taxpayer money in. It's the only way forward.
OK, are we going to hear something very different? Yes, we are, from Sean Worth.
We are. I don't think money itself is just the answer. We're going to have to pay more in because we're a growing, ageing population. Fine, we will put more money in. But we've got to add more. And I think that, the final piece here is opening the NHS up to more private investment, social enterprise, charities come in, help deliver these services, help us create new ideas. The smartphone apps we're talking about, why not put them on prescription if people haven't got smartphones? We can embrace change, new ideas. We have to think a bit outside the box. Money is not the answer.
OK, right. There they are, the closing statements from our advocates. Those are the arguments. Now it's the turn of our audience who've sat and listened very intently here this evening. They have their say on whether increases in NHS funding should be paid for out of higher taxation in all its forms. Now, each of you has a voting pad, I know, sitting there in your hands. If you've been convinced by Sonia Sodha's case for a fully taxpayer-funded NHS, it's very simple. Press option 1. Option 1 for Sonia's view. If you don't agree, I think Sean Worth is right that the NHS needs more private investment of whatever kind to survive. Choose option 2. Let me repeat, it's very simple. Option 1, if you agree with Sonia's arguments that it should be paid for. More money for the NHS should come from general taxation. If you think that the private sector, private funding has a role to play, vote number 2. And we will process that very quickly and bring the results to you all in a moment or two. But if you haven't made your mind up at home yet, there's a lot more information I can tell you about the National Health Service, including special reports, analysis and interactive graphics on skynews.com. You can also join the debate on social media. Just use the hashtag NHS70, and we'll have much more coverage here on Sky News tomorrow as the NHS formally marks its 70th birthday, including a special service of celebration at Westminster Abbey, which just shows the place it has in the nation's heart. But now I think I can bring you the results of the verdict of tonight's debate. We have 46% voting yes, that is yes to more funding coming from taxation, only 54% saying no. Now, interestingly, I want to compare that with the straw poll, a similar vote we put to our audience before we came live on air, and that compares. There has been a shift in opinion, a slight shift in opinion, because when we voted just before, as I say, we came on air, 39% said yes to more funding coming from taxation only. That's gone up to 46%. So well done, Sonia, with your persuasive arguments. And 61% before we came on air, 61% thought we should look at other forms as well. That's still a majority, though. So well done to you both, Sean and Sonia. Thank you very much indeed. Now, I want to get final thoughts on that result and how the audience changed their views. And thank you very much indeed for listening so intently from our panellists this evening. We'll just go down the panel. Lord Darzi, are you surprised, first of all, by the numbers that support the different options?
I mean, to be honest, they're there more or less.
Well, it's more or less 50-50 now.
50-50, absolutely.
Would you have expected to be more weighted towards general taxation?
I would have been, because there was a recent survey nationally which suggested that 80% of people will like to increase the funding of the NHS through taxation, and that came across. But, you know, you have different audiences and different...
Indeed.
Indeed,
but what it does tell us, though, is that, you know, there are other ways of raising money. And, of course, we talk about the NHS being free. Of course it's not. We just all pay for it.
Absolutely. There is nothing for free. You are paying for the NHS. But the only thing I will add to that, how much you pay for the NHS, how much we all pay in this country, compare it with other countries, we do very well. It's the most efficient system. If you look at the outcomes at a national level, we do much better for the amount of money we spend.
OK, Sarah Wollaston, a majority here for looking at other ways of getting money into the National Health Service. And, of course, one looks just across the Channel and beyond, and we're thinking here of, you know, some degree of private insurance, perhaps.
What I think is interesting, though, is that they're talking about different things. Sonia's talking about how we raise the money, whereas Sean's talking about how we spend it more efficiently.
So, you think
I don't think they're mutually exclusive.
Them,
so I think what we really need is a more nuanced question about the different ways that you can lever it in, because it's not all going to come through taxation, as in, you know, there are very many ways that we can spread that. So I think that the question, if you don't mind me saying so, is a little bit too simplistic.
That's television for you.
Sorry.
No, feel free. It's a free and fair debate. Helen, well, on the numbers, simplistic or not, it does show, you know, quite a split within views. You know, there is a debate available here, which is what we're having, of course.
There is a debate, but I mean, I have to say, having lived through some of the privatised bits of the NHS and see how things have been tried, where private companies have come in and failed, and it's gone wrong. And Sonia did refer to some of the rather embarrassing failures where things just haven't worked.
Well, we touched on it with the IT project as well.
We did, yeah, absolutely. And I think, you know, so we need to absolutely be aware, and if we're going to go this route, then we absolutely have to learn from the past. Now, I'm very, very cautious. In general practice, it really hasn't worked terribly well. So I have to say, I'm on your side, Sonia. I really feel that it's from the public person, so bring it on.
I wasn't asking you to take sides, but you have.
Enjoyed it.
David, are you going to take sides?
Well, I'm on both sides.
Fence-sitter extraordinaire.
No. Was it 52-48?
It was 46-54.
All right, so I won't mention Brexit. the consequence of that for all the...
Really, that's a whole other debate. But
you know, it is the most efficient, the most effective way of raising money, general taxation, you know, throughout the world. If you just think in the United States, they spend $500 billion collecting the money before they can give it out to healthcare. $500 billion.
What a waste.
And not a penny of that is spent on direct patient care at all. And it costs us almost nothing.
David, thank you very much indeed. And that's it for this special debate about an institution with a special place in British society. Our thanks, of course, to Guy's Hospital for putting up with us. Thanks, too, to our contributors. They are Sonia Sodha, Sean Worth, Sir David Nicholson, Professor Helen Stokes-Lampard, Lord Darzi, and Dr. Sarah Wollaston MP. And thank you to our voting audience here and to you at home for watching. From all of us here at Guy's Hospital, a very good night.